Colds spread easily, especially within homes, classrooms, and workplaces. We call colds common because, as their name implies, it's widespread. More than 200 different types of viruses can cause cold, but the most common cold virus is the rhinovirus. Let's discuss cold today and get to know what to do when we have them. A cold is a contagious upper respiratory infection that affects the nose, the sinuses, the throat, and the windpipe, also called the trachea. When you have cold, you may admit that it's quite challenging trying to get rid of it. You can't get cold and get rid of it in just a jiffy. This is so because it is a viral infection. Signs and symptoms of common cold happen in stages, and we'll get to know how and when you get the signs and symptoms. Before we go to the signs and symptoms, let's talk about incubation period. Medically, when we talk about incubation period, we are talking about the time between when you are infected and the time when your symptoms first appear. So the incubation period for common cold is 12 hours to 3 days. Within 3 days of catching the cold or picking up the cold virus, you get symptoms like sneezing, coughing, headache, runny nose, nasal congestion, and also fever. This is stage 1 of the signs and symptoms. In the stage 2, the symptoms typically worsen or get to their peak, and you get signs and symptoms like body ache, generalized body pain, fatigue, in addition to the signs and symptoms you got in stage 1. When you get to stage 3, the signs and symptoms begin to wind down. In this stage, you will be free and clear at this point, but then some of the symptoms still persist. You may have noticed a change in my voice today because as I talk to you now, I'm also having a cold. And I think I'm in the stage 3 because my symptoms have started to clear. Now, how do we treat colds? Usually, colds are not cured. When you have cold, you just have to boost your system, your immune system, and let it run its course. However, you can purchase over-the-counter medications. Over-the-counter medications are also called OTCs. These are medications we get from the pharmacies, the drugstores without prescription. Some of these medications are useful in reducing the symptoms of cold so that you become comfortable and free until recovery. Now, some of the medications that may relieve cold symptoms are pain relievers like paracetamol and ibuprofen to relieve pain and headaches, decongestants for the nasal congestion. We have antihistamines for the runny nose and sneezing, cough suppressants for prickly and dry cough, and then expectorants for cough that comes with sputum or mucus. The expectorants help thin out the mucus or helps loosen the mucus so that they can be brought out when you cough. I'm sure you may be wondering why we don't use antibiotics in the treatment of common colds. Yes, because colds are viral infections. Antibiotics are rather used in the treatment of infections that are caused by bacteria. So antibiotics for bacterial infections and then viral infections are managed. Can cold also kill? No. Colds are not fatal, but in people who have weakened immune systems or people with compromised immune systems, common colds can lead to a condition that can be severe rather. Such conditions are asthma, chest pain, sinus infections, or ear infections. Prevention of colds includes frequent hand washing, avoid touching the face in order that you don't transfer the germs from your hands to the mouth, the nose, the eyes, and all other areas of the face. You clean frequently used surfaces like doorknobs or surfaces where people frequently touch. You also have to strengthen the immune system by getting enough sleep, eating healthy, and exercising to ward off the germs. And also, don't forget that the best self-care for colds is that you get plenty of rest. you can consider taking some time off work or from school, at least in the first few days of the illness, as this will also help you to avoid transferring the infection to others. Use hand sanitizers in cases where you can't get soap and water. Drink enough fluids or take in plenty water in order to keep the nose and throat moist. Avoid taking alcohol and caffeine as they have a drying effect. I thank you all for sticking around. Like and share the video for me, and also subscribe if today is your first time of watching my videos. Until then, I'll see you in my next video.